Hi everyone, we might get started. It's 5 o'clock on the dot. Thank you for coming this evening to the 2026 AMA Queensland Intern Readiness webinar. My name is Dr. Emma Hodge. I'm the chair of the AMA Committee of Doctors in Training. And I'd firstly like to acknowledge the traditional custodians on the land in which we work and live today and pay our respects to elders past, present, and all those Aboriginal and Torres Strait Islanders in the room today. So today we've got two parts to this presentation. Firstly, I'm going to do a presentation on tips and tricks and taking the plunge and getting started for your intern year, which is very exciting. And then I'll be followed by my colleague, Dr. Hao Tan, who is president of ASMOF-Q, to talk to you all about the benefits of joining the AMA Queensland or ASMOF-Q union. So firstly, we'll talk about the transition from being a medical student to being an intern. While it's a very exciting time, it's obviously very nerve-wracking. So I hope you find this presentation useful with some practical advice on how to get started in your first couple of weeks as a doctor. So firstly, congratulations. Welcome to your internship. The focus of this talk is really just to give you some advice on how to get the most out of your year and not just get through it, but really thrive and not just survive, and also enjoy your internship. While it is obviously a stressful and busy year, it is also a really rewarding time following all of your hard work through medical school. So just some basic tips, which sounds fairly obvious, but are really helpful things to make sure that you get a good start to your internship. Firstly, comfortable, supportive shoes are essential. You will spend a lot of time on your feet as an intern, and it's really important to make sure you have not only good footwear, but also really comfortable clothes, whether that's scrubs or professional wear. Regardless of what you wear, just make sure you do feel comfortable in it. Things with pockets can be really handy as well. And make sure you do bring snacks, because sometimes your break times can be really unpredictable. And depending on which hospital you're working at, sometimes there may not be food on site that's necessarily close to where you're working. So it's really helpful to bring a bottle of water, some snacks, and just take your opportunities where you can throughout your busy days to take a quick break. Make sure you also plan on how you're getting to work. Again, depending on where you're working, there may be limited parking options. You may need to consider taking public transport if it's a possibility. And do take time to learn the layout of the hospital if you're not already familiar with it. So learn where the bathrooms are, importantly, where the cafe is to get coffee, and where the doctor's rooms are. And you always end up with things in your pockets. So think about where you're going to put all of your resources, and make sure you know where the doctor's room is and where to put your bag on your first day. In terms of organising yourself on the wards, there's a couple of different tips that can be really helpful to set yourself up for a really organised day. Firstly, make sure you find a tool that works for you. And what I mean by this is some sort of organisation system that can really help you to coordinate all of your tasks on a day. This might be a clipboard, it could be a notebook, it could be one of those box files if you are working in a paper-based hospital that allows you to also keep medication charts and script pads. Whatever tool works for you, you will observe different interns and RMOs using different types of strategies to make sure that they're organised. And if you don't already have one, then maybe try out a few different options in your first few weeks as an intern. But it's really good to have a system where you can collate all of your to-do lists, all of your tasks for all of your patients, and have a way of systematically checking things off so that you know that all your tasks are collated in a way that you're not going to miss things. One of your tasks as an intern, so I'll just go back one. One of your tasks as an intern will also be to compile a patient list. So make sure you put all of the important contact numbers, including extension numbers for different contacts on that. And that could be really useful to avoid going through switch every time. One of your roles is also going to be to complete lots of documentation. So make sure you have a good system for writing your notes, using the ward rounds to ask questions, and always clarify the consult question. So for example, let's say a consultant says, let's order a CT scan for this patient. Make sure you know what the clinical question is so that when you're contacting radiology, you know what the indication for that scan is. And then lastly, after your ward rounds, hand over to your nursing teams, update your allied health members. They will really reward you for it. And it's really helpful to be part of that multidisciplinary team, because there's so many skills that our allied health professional colleagues can offer us to support our patients. So things like occupational therapists performing capacity assessments, speech pathologists looking at swallow studies, social workers looking at nursing home placements. There's lots of really useful skills that they can really help you with as an intern. And sometimes things that you think might be your role as an intern can actually be really well supported by an allied health professional. And do make sure you're updating your nursing colleagues on any change in the plan for your patients. Let them know about discharge planning, about which patients might be going home, which can support patient flow in the hospital. And then make sure you're handing over to colleagues. So if you're working a day shift, make sure that you are letting your after hours colleagues know around any patients of concern, handing over any weekend plans, which can be documented in the notes, and pre-ordering bloods for the after hour period to minimise the workload for after hours junior doctors. Make sure you familiarise yourself with the paperwork as well. Some of you will be working in electronic medical records and others will be working at paper-based hospitals. But make sure you're familiar with prescribing, whether that be electronic or paper-based, as well as how to order fluids, monitor blood sugar levels, and also how to request pathology and complete discharge summaries. These 5 things are really core intern tasks. So make sure you spend a bit of time familiarising yourself with paperwork and really becoming confident and comfortable with how to complete these tasks, particularly on your first rotation. Referrals are another common task of an intern, and this is a bit of a guide on how to complete them. And my key tips are really make sure that you thoroughly review the patient notes and have all of the information in front of you so that if you are asked a question around a particular value or metric, you are able to reference that immediately. But also make sure you know what the question you're asking. Are you asking for advice from a particular specialty? Is it a takeover of care? Is it something relevant to a pre-existing condition of which the consultant or registrar may know about? Make sure you're really clear using the ISPA format around what it is that you're asking in that first 10 to 30 seconds of the referral so that the person receiving the phone call is really clear about what it is that you're asking. And also make sure you're asking them, is it a good time? Introduce yourself as an intern. That can help them give you a little bit of leeway in case you don't have all of the information, but make sure that you are providing everything around the situation, the background, and then that request or recommendation to make sure that the referral is fairly succinct. And this is a bit of a referral cheat sheet that has some particular information that certain specialties and subspecialties may be after. So think about who it is that you're asking a referral for and particular information they might want to know. For example, surgery will always ask around when they last ate. Pediatrics will usually ask about developmental history. Just be specific for the information that you're providing that particular specialty. In terms of being a good intern, you have an opportunity to really provide some patient-centered care. So often as an intern, you are able to provide more time with the patient than potentially your senior colleagues, your registrars and consultants. So for example, you might be on a ward round, a patient may have a very quick management plan discussed with them by the consultant, and then you'll be on to the next patient. But because you often spend a little bit more time on the wards, you may have the opportunity to then go back to that patient, explain what was discussed in the morning ward round, and be able to answer their questions. And that can really help build that patient rapport, and it can be a really rewarding part of being an intern. If you don't know something, make sure you clarify plans and expectations. This is the year that you can play the intern card, so don't be afraid to speak up and ask questions. And if you're ever unsure about patient safety, then please make sure that you consider a MET call or escalate early to your PHO or registrar. And if you're struggling with workload, make sure you understand the roles of different levels. So escalate to a registrar, a consultant, but also understand your allied health team members about what they can offer in the support of your patients and your workload. In terms of your mindset, so you may be happy with some of your rotations and others you may be less looking forward to, but keep an open mind because routine tasks can provide insight into what it's like in certain specialties and can provide skills that may be transferable to whatever specialty you may want to pursue in the future. It's also very different working in it as an intern compared to a medical student. So even if you may not have enjoyed a particular placement as a medical student, you may actually really enjoy it as an intern. And make sure you're making the most of opportunities to learn in terms of opportunities in education sessions, sim sessions, M&M meetings, or even some of the registrar teaching. There's always so much happening in the hospital in each department. So really make the most of contributing to your knowledge base, again, regardless of which future direction you want to pursue as a doctor. And sometimes mistakes will happen. It doesn't make you a bad doctor. You are learning. So do be kind to yourself because you are interns. Make sure you are always practicing within your limits. Obviously, if you're unsure, don't do it and do seek help early. And when you're escalating for help, make sure you're stating the problem, but also thinking about the potential solution. So instead of just saying, I've got a situation, I don't know how to manage it, potentially suggest what you think might be the option, because even if you're wrong, it becomes a really good learning and teaching experience for you. And in all of this, it is a busy job, so don't forget to take care of yourself. And you really need to make sure you have your own GP. It is part of our APRA Code of Conduct, which you will have signed upon receiving your APRA registration. Doctors need doctors too, so avoid the corridor consults. Do have a regular GP. And if you are struggling to find someone, then do reach out to Doctors for Doctors or Doctors Health Queensland, as they will be able to provide immediate support to a GP who is available on call 24/7, but also then link you in with a longer term contact or a health professional located in your area. Make sure you also have some time for a social life where possible. Get outside, keep active. Queensland Health also offers the fitness passport. And do try and have some sort of work-life balance, such as creating a bit of distance from work by maybe downloading the Outlook app so that you're not getting constant email notifications on your days off. You are also it's also a really good idea to get some indemnity insurance. This is often free, and a lot of our AMA Queensland sponsors offer some really great opportunities and options for getting indemnity insurance. So make sure you sign up to one, if not multiple, companies during your intern year to get a sense of which company you might want to join when you do have to pay in your later postgraduate years. Do be careful with what you post on social media. Just try and keep a distance from posting anything work-related. And do also look into salary packaging. RemServe and Smart Salary offer some really great options within Queensland Health. And I would also highly recommend getting a medical tax accountant such as Cutcher & O'Neill for when you do your tax return, or if you're ever looking at buying a house. They are a fantastic partner of AMA Queensland and offer really good insight into particular options and deals that you can get specifically as a doctor. There's also something called the Blue Light Card that AMA Queensland enables you to tap into and can give you discounts on some really great stores that saves you money as an intern, which is always a bonus. I'm just going to whiz through a couple of really good resources that will be helpful throughout your internship. So ETG provides some really good guidance on antimicrobials. MIMS and AMH are really good for prescribing, particularly for new medications where you might want to look at contraindications or side effects. Dynamed or UpToDate, if your hospital has it, is another great evidence-based guideline. And the PBS is another good one to save potentially as an app or as a link on your phone, because you will frequently be consulting it when you're providing scripts. Yep, next slide. We can whiz through these. I've just mentioned them in passing. But all of the Queensland Health computers will give you access to these databases as well. These are some of the really good books, and I would highly recommend downloading the MD Calc and the Opioid app, as these are really helpful throughout all of your rotations. And the AMA Queensland intern guide is another great source of information. So this has advice on a variety of different topics that will really help you through your intern year. So if you're an MA Queensland member, you can get an electronic copy of this. And if you attend any of our events, we often give them out in a physical hard copy. The Shift app is another great one that provides specific wellbeing support for doctors in training and is evidence-based and was created by junior doctors in New South Wales. Next slide. This was also created by the Black Dog Institute that offers free access to a clinical psychologist or psychiatrist that can be offered via telehealth and without a Medicare referral. There's a lot of work going across the state within Queensland Health regarding wellbeing, and this includes the Mind Reset modules that were created specifically for junior doctors that are available on iLearn. It's a series of 7 modules that can support junior doctor wellbeing. And don't forget the Queensland Health Clinical Guidelines. This is an example of the electrolyte guidelines that are really helpful regardless of your rotation. But there's also a number of other electrolyte, or rather a number of other prescribing guidelines that can be really helpful to print out and keep around or just save on your phone for quick reference when you're unsure on exactly what dose or how to prescribe. And it's also worth considering a list of useful medications such as this for really common conditions while you're familiarising yourself with the common doses of medications. And don't be afraid to ask for help. So you will all have a medical education unit with a medical education officer and director of clinical training. They can be great people to contact if you're ever unsure on where to go for help or if you have any concerns, as well as, of course, your immediate registrar, consultant and term supervisor for any clinical issues. And then more broadly, you can get involved in JMOFQ, the AMA Committee of Doctors in Training, and also reaching out to your GP, Doctors Health Queensland, or your junior medical society for support as well. So I'm now going to hand over to Dr. Hao Tan, who will give a presentation on knowing your working rights as an intern.
Thank you, Emma. That was a very informative presentation. I wish I'd been able to receive it when I was an intern many moons ago. Thank you all for joining us. I know you're all probably very busy with your orientations at your various hospitals. So just to introduce myself, my name is Hao Tan. I'm an anaesthetist. I think I'm wearing fairly comfortable clothing and footwear as advised by Emma at the moment. I've been working for Queensland Health for 25 years. So, you know, I've I guess been through the system for a long time, and I know how important it is to have safe workplaces, but also have the right employment conditions all the way from interns to senior staff specialists. So I'm here today to talk about ASMOFQ, which is the Doctors Union, which is the union partner of AMA Queensland. So we're basically, could we go back one slide, please, just to say who we are? Yep. So we have quite a lengthy name in terms of our acronym. So we are the Australian Salaried Medical Officers Federation Queensland Industrial Organisation of Employees. I didn't choose that particular name, but we've had it since the year 2000. So next slide, please. I'm also very happy for people to put questions in the chat as we go along. So what do we do as your union? Well, we fight for better working conditions. Some of you who may have been following our social media or our website blog, we've just come out of a MOCA negotiation, and that was 7, which was certified in October last year. And we do that every 3 years. It's a very important piece of work that we do on behalf of doctors working for Queensland Health. MOCA covers not just junior doctors and senior doctors, but it also covers students in medicine since around the COVID times. And some of you might have been working as students in medicine over the last year or so in your final years of medical school. So the MOCA contains most of the important working conditions, such as your remuneration, such as your overtime rates, your fatigue provisions, other things such as digital recall, your rostering, and a whole bunch of important clauses and provisions that cover how things operate within your workplace. There are about, I think at last count, over around 13,000 doctors who work for Queensland Health, not all full-time. So this agreement covers quite a huge number of medical officers. The other things that we do is we enforce your employment contract and workplace rights. So it's not it's only part of the game to negotiate favourable and improved clauses and provisions and conditions with each iteration of MOCA. During the times in between MOCAs, we rely on our members to let us know and be vigilant to make sure that their conditions are being fulfilled. And so if you go to your various workplaces and you think that things aren't quite right, you're not getting what's prescribed in the mocker, please reach out and contact us. We can represent you on individual issues. So if you have an individual problem at work, for example, not getting access to leave, if there's a rostering issue, if you think that your rostering is or your workloads are becoming excessive or unmanageable, please reach out and let us know, and we can represent you on that. If you feel that you're being bullied or harassed, or you've witnessed bullying and harassment and you need some support and advice, absolutely reach out and let us know. And it's not just individual issues. Sometimes these issues affect a group of you and your colleagues, whether that's in a department, whether it's a broader collection of medical officers, and we can certainly represent those groups depending on the issue. We've also been advocating on just general system-wide issues, such as physician assistants, pharmacist prescribing. They're two of the most recent issues that we've been pushing back on. But in previous times, again during COVID, we've been advocating on behalf of all the doctors within Queensland Health for provision of and supply of appropriate PPE, which was a major issue at the start of COVID. And also fit testing of the N95 and P2 respirators. We had to run a dispute in the QARC to essentially compel Queensland Health to do proper fit testing, which leads very nicely into that last point, litigate matters in the QARC. I guess this is put into the list because this is one of the main and strongest actions that we can do on behalf of our members to hold employers such as Queensland Health to account. I might just switch to the next slide. I might just touch briefly on physician assistants and pharmacist prescribing. There's no doubt that you and your colleagues over the last few years probably have been having some discussions looking at what's happening in the US and the UK, more specifically in the NHS, with physician assistants. These are real big ticket items that we're pushing back on. And I think it's really important that as a profession, we stand united to get the best outcome in terms of resisting these inferior models of care that will have significant impacts on patient care and also have significant negative impacts on our profession. Okay, just to switch tracks back to working for Queensland Health. So, as you probably gathered from Emma's talk, you're going to have good days and good times and good periods where working for Queensland Health seems, pretty nice and they're looking after you. And unfortunately, there'll be some tougher times as well. You can go to the next slide, where you feel like you're battling every single minute of every single day. And we're certainly we're passionate about supporting members, not just in the good times, but absolutely when they're facing very difficult challenges. We talked about well-being earlier in this session, and we see that as one of the key items going forward in terms of where we need to move our profession to. Okay, we can go to the next slide. So what are your working conditions? Where would you go to be able to understand what you and read what your working conditions are? Unfortunately, in Queensland, we always like to do things a bit differently to other states and territories, and it's a very, very complex framework of documents, and industrial instruments that basically prescribe the entirety of your working conditions. So go to the next slide, please. So two of the key documents to gain an understanding of exactly what you're entitled to would be the MOCA, which is the Medical Officers Certified Agreement. And we're at number 7, which got certified last year. That will expire on the 30th of June 2028. And there's another document called the Medical Officers Award, which is dated 2015. Now, they work in conjunction, and There's a bit of an overlap between some of the conditions prescribed in both documents. Where there is any inconsistency, the mocker will prevail. Okay. So to get a full understanding, you need to read both documents. Both documents are well over 50 pages. So essentially, if you have a question that you would like answered, shoot us an email and we'll get back to you as soon as we can. Now, the key items that are covered in those two documents are remuneration, so your salary, your rostering, how that works in terms of the number of hours a week you work and how that can be allocated within a roster, your overtime provisions. So that will dictate, the rates of pay when you get paid overtime, but also more in recent terms, something that we have improved quite significantly over the various iterations of Mocha is how you claim that overtime. You no longer need to get prior approval for working overtime a number of very common activities, such as if your ward round runs late, or if your clinic runs late, or if you're in theatre late, or if you've got an urgent admission or discharge that you need to do. You don't need to ring up your supervisor or your consultant 5 minutes before your shift is meant to end to ask if you can stay. So that's certainly an improvement, and certainly a distinction between our other or the other states such as New South Wales and Victoria. We have fatigue provisions. For example, the requirement to have a 10-hour break between shifts. Again, that's something we've improved and tightened up over the various iterations of Mocha. Your leave entitlements, so not just annual leave, but professional development leave, examination leave, which was a big one. I think there's a slide that we can show you the history of how that's really improved through our negotiations over various iterations. Sorry, do you mind just going back 1 second? I'll just cover the... Thanks. On-call and recall. We had a big win in Mocha 7. So recall, we've had digital recall for a number of Mochas now, where you could access a medical record and provide some advice or change in management to a patient and be paid for that. Now with Mocha 7, you will be paid for phone calls, which materially impact patient care as well. So that's certainly a big step forward. And professional development as well, in terms of the allowance, and you either get a subsidy for vocational training or a professional development allowance, which is indexed, but also that includes examination leave and also your PDL now, which can be used to study for exams. So all those things have moved forward over this time. Thanks, Hayley. So just to go through the history, so Mocha 5, this is going back to 2018, I believe. We had big increases in the professional development allowance and vocational training subsidies. However, even though they were big at the time, we still are very mindful about cost of living increases and also the increasing costs in terms of education, college fees, examination fees, et cetera, et cetera. So we are of the mindset to just keep pushing forward and fight for those incremental gains from Mocha to Mocha. In Mocha 5, again, going back to 2018, we had a really big increase in professional development leave. We had a huge increase in examination leave now that you get an extra 3 days in addition to each day that an exam falls on. We also had rest pauses added in. So in addition to your lunch break, you also got 2 paid 10-minute rest pauses. Digital recall that I mentioned, that came in 2018. And a big thing that affected junior doctors, particularly those who went overseas to pursue further training and experience, was the ability to preserve any accrued PDL for 24 months. So you could spend 2 years interstate or overseas if you were pursuing some, bespoke or special experience and training over there, and come back and have those entitlements preserved. Thank you. Next slide, please. So the main headline items for Mocha 6, which was in operation from, I believe, 2021, 2022. That was a period of time, if if you can recall that we had quite significant inflation around COVID. So we had wage increases of 4%, 4%, and 3% over the 3 years of the agreement. Plus, we were topped up with an extra 3% as a cost of living allowance in case inflation exceeded those amounts. We tightened up and at the time that was nation leading in terms of the wage increases. So we were reasonably satisfied with that outcome, with that aspect of MOCA. With respect to fatigue, we strengthened the provisions there and closed some loopholes. Payment of overtime, that was when there was no pre-approval required for a number of very common reasons for junior doctors to stay back after work. We had the implementation of the workload management kit, and that was developed with ASMOFQ and Queensland Health during the life of MOCA 6. So if you go to our website, you'll be able to access the workload management kit, or you can email us and we can send it to you. That is a way that you can report excessive workloads. If you have a concern about your workload or really anything that's happening at work, and you just want to have a chat or send an email to us, please reach out. We can just start off with a very confidential and private conversation, discuss what's happened, get a bit more information and detail from you if required, and then lay out some options for you to consider. And then if you wish to take further action, we'll absolutely support you on that. And we also made some significant improvements to rostering. Rostering is always a tricky one because, as you all know, the medical workforce has, faced challenges in terms of numbers and shortages everywhere. So it's something that we keep a very close eye on. And even with MOCA 7, we are going to perform some work over the next 12 months to improve the rostering guidelines. Thank you. Next slide, please. MOCA 7, the most recent MOCA negotiations. So we've had wage increases. We've had also indexing of PDA BTS. We've had an increase to the night shift allowance to recognise, the difference between working an evening and a night shift with regards to, the effect on your body and the effect on your life. And we've also had the addition of career medical officers, which is, I think, a really big thing for us, and we're excited about it. It is something that we can use as well to counter all of the role substitution and the push to have physician assistants, pharmacists prescribing, non-medical practitioners. And it gives, I think, junior doctors another option if they decide that they don't want to necessarily follow the tried and true pathway of going down a specialist training program. PDL can now be used for studying for an exam, which I think is a really good thing. There are new clauses on workplace behaviour and workplace health and safety. And again, these are, I think, really important clauses, particularly when it comes to well-being and safety at work. And I also mentioned digital recalls, that phone calls which materially influence patient care will now be paid. We are working on the guidelines for that. We understand that, and I think it's a mutual understanding that we don't want this to go out of control and be claimed by every single phone call. I think there's some phone calls that are very short and are FYI phone calls, but certainly the ones where you're spending a significant amount of time, you're processing or you're gathering and processing information, and then you're putting together a management plan or a change in management. I think that needs to be recognised as proper work. Could we go to the next slide, please? Okay, so why should you join us? As I outlined before, we are able to handle all workplace and industrial matters for you, whether it's negotiating agreements, which when the next MOCA comes round, we'll be reaching out to you guys or our members as for input on what they would like to see in or what they're seeking in terms of our log of claims for the particular mock-up. And that will clearly be based on the experiences that you've had within your own individual workplaces, and some of the problems that we might need to address or improve. But specifically, why should you join ASMOFQ? Well, we're the only union that's run by doctors, and we only serve doctors. There are other unions within Queensland which cover a number of professions, and I think that can potentially raise conflicts, whereas we like to keep it very simple. We're only here to serve and support medical officers, and within our organisational structure, in terms of our management committee, we are all doctors. So our focus and our drive is very clear. We are, and this goes for any union or organisation, whether it's ASMOFQ, whether it's AMA Queensland, we are only stronger in numbers. So the more members we have, the stronger we are, the more effective we are, the better outcomes that we can achieve. And I just like to remind everyone that we are a very democratic institution. We are a very, open and transparent in terms of we encourage members to reach out to us and put forward ideas or get involved, and use the organisation as the collective vehicle for change and improvement within workplaces, hospitals, the care that we can provide our patients, and our profession. Cool. I might, so that's our website and our email address. There's a QR code there that you can scan. So that will link you into our website and also to a join page. And I just want to say, I know this was the previous slide, there was a little signpost there saying there are tough times ahead. And while I don't want to necessarily end on a negative note, I know starting off your medical careers as interns is exciting, and it should be exciting. But certainly the way I see how things have gone over the years, I mean, I got involved in union work and being part of ASMOFQ as a result of the contracts crisis back in 2014, 2015. And, talking to my colleagues, I get the sense that we are in for some tough times. There are other organisations and special interests out there that are trying to push their own agenda, and in some ways that runs counter to what we like to see for our patients and our ability to care for our patients. So I think it's really important going forward that now's probably a very important time, more so than previously, that we stick together, we stand together, and we fight for those common goals and outcomes. And on that note, I'll finish. So thank you all for your time.
Thanks, Hal. So now I'd like to talk about some member benefits for joining AMA Queensland. So there's quite a few benefits of joining AMA, and I hope some of you are already members, but if not, it's a really great opportunity to be involved in professional networking. So there are so many events run by AMA Queensland, and you can meet people in different specialties for different hospitals, and you never know where that might lead. So it can be really invaluable to meet people in different hospitals, because then you can find out about different opportunities, potentially gain opportunities for different roles across Queensland Health, and also then seek support or mentors who can help guide you in a future career direction. Next slide.
Emma, sorry, you just need to unmute.
I am unmuted.
Oh, you are?
Okay. Yeah.
It was coming up as mute on my screen, sorry.
Okay, no, all good. Yep, so next slide. So there's also quite a few different services, including the AMA Career Service, that can help with your resume, CV applications, and can really give you a head start in applying for specialty training. Next slide. AMA also provides advocacy at all different levels. So particularly for an intern perspective, the Committee of Doctors in Training has a representative from every single hospital in Queensland. And that way you can be involved in actually advocating for various issues at your hospital, or maybe more broadly issues across the junior doctor setting. And there's also different committees at different levels. So throughout your medical career, there's always someone who can advocate for you as our peak body for doctors across the levels of training. And as Hal mentioned, by joining AMA Queensland, you're also involved or also part of the union. So that gives you support and protection to negotiate any of your pay or conditions, resolve any industrial matters, and also just make sure you're paid fairly and treated fairly as an intern. And you don't necessarily have time to look at all of the industrial agreements. So knowing that someone is able to answer your queries or look into those issues on your behalf can be really invaluable. There's also a number of resources that you can tap into by joining AMA Queensland. This includes the intern guide that I mentioned previously, as well as accessing the script, which is a monthly newsletter for doctors in training, Dr. Q, which is a magazine that's sent out for doctors or AMA Queensland members, as well as a number of different resources through the member portal, and of course involvement in the resident hospital health check, which can be really great for providing feedback about each of the hospitals and the doctor in training experience. There's also lots of educational resources that can be really helpful as well. And access to member benefits, including our corporate partners. So one of the things I mentioned earlier is one of our corporate partners is Cutcher and Neil, as well as lots of legal and financial advice from other corporate partners as well. So you can tap into some really great opportunities and services. And speaking of Cutcher and Neil, you can book a consultation today by scanning this QR code, and they'll give you access to their Wealth Start package as a discount for AMA Queensland members. There's lots of upcoming social events. So we have our Medical Careers Expo upcoming in March this year, so 14th of March. And if you're an AMA Queensland member, this is free. Otherwise, it's $99. So you can see by joining AMA Queensland, it pays for itself by enabling you to access some of these events for free. And this is a really great opportunity if you're thinking about where you might want to go in medicine, as a lot of the colleges and the different health services join, and we've got over 40 sponsors, or 40 sponsors for this event, so that you've got a really great opportunity to suss out different options for your future medical career. And we also, very excitingly, have our Junior Doctor Conference this year in Mackay. If you sign up to be an MA member before the end of February, we are giving away some packages that will cover some of your travel and registration, which is, I think, up to the value of $600. And the Junior Doctor Conference is a really great opportunity to meet other doctors from different areas, but also gain skills. There's some practical skill sessions, career sessions, often some local topics as well. So it's a really fun weekend, and also a chance to get away and experience something different, which can be a nice thing to look forward to during your internship. So this just summarizes some of the benefits I've discussed. So hopefully you are keen to get involved. Maybe you want to even join one of the committees, be involved in the Committee of Doctors in Training. And there's a great offer on board to join AMA Queensland. You can get a $100 discount off your annual membership fee if you sign up this month or before the end of February. And this can also put you in the draw to win some tickets to the upcoming Junior Doctor Conference. And by joining AMA Queensland, you're also then automatically a union partner. So you are covered by ASMOFQ as well, which means you can tap into all of the benefits of what Hal spoke about earlier by joining ASMOFQ. So that concludes the Intern Readiness webinar for now. So thank you for everyone for coming. And if you have any questions, I'm happy to stay online and answer any of those.
There's no questions in there at the moment, but we'll just wait a few minutes.
Thanks, Haley.
maybe if anyone has any questions after getting off online, that they do have any questions, just to send it through to the registrations@amaq.com.au email address. And it's just the email that was sent through the webinar reminder, so you can just reply back to that. And then Emma obviously chairs the Committee of Doctors in Training, so she'll be happy to answer any of those questions, or we can obviously get our SMOF queue to answer any other questions for you. If you have any questions about membership, Emma and our membership team can obviously reply back about that. Yeah, I think we'll sign off, Emma.
Thanks for coming, everyone.